Today's lecture is on procedural coding. What is procedural coding? These are the codes assigned to any procedure that takes place in any medical setting, whether it's inpatient or outpatient. These are the codes for what did I have done when I went there. The CPT manual is called the Current Procedural Terminology Manual. It is created and maintained by the American Medical Association, the AMA. And the organization of the manual is as follows. We have 6 sections. We have evaluation and management, and this part of the manual is where did I go for my healthcare service? So for an office visit, not only do you have why are you here with the ICD-10 code, but now with the CPT code, you have where did I go? That's evaluation and management, and what did I have done? And what did I have done is in the anesthesiology, surgery, radiology, pathology, laboratory, and medicine sections of the CPT manual. So again, the CPT manual answers 2 questions. Where did I go? That's evaluation and management. And then the rest of the manual answers the question, what did I have done? The general CPT guidelines are as follows. First of all, every CPT code is made up of 5 numbers. Every code. We can add things on and other modifiers and such, but CPT codes are made up of 5 digits. ICD-10 codes are made up of a letter and 2 digits and maybe more. But the difference is ICD-10 codes start with a letter and have 2 numbers or more, and CPT codes are 5 digits, 5 numbers. So here are some of the symbols used in the CPT book. We have the blue triangle, which signifies a revised CPT code. So it may be that the codes that have been used, we needed to add a little more information to. So now we have a revised code. The red dot designates a new CPT code. The pound sign denotes CPT code out of sequence. Facing triangles means the code text was changed, so maybe we had to explain something a little bit more. The circle with a diagonal line indicates multiple procedures or an add-on code need to be used. A lightning bolt signifies FDA approval pending. And the bullseye is used for moderate sedation code. And moderate sedation, one example is having your wisdom teeth out in the dentist office, surgeon's office, dental surgeon's office. We use moderate sedation there. And the lightning bolt for approval, the telemedicine code had the lightning bolt on it for quite a few years. And then a couple of years ago, a red dot showed up next to that code because the FDA had approved it, and now we had a brand new code for telemedicine. The CPT code format, again, is 5 digits. There may be add-on codes, and there may be modifiers, and we would use add-on codes and modifiers for specificity. This means there's more details. The more detail we give to the insurance company, the higher amount of pay we're going to receive from them. There are Category 2 codes, and again, Category 2 codes are usually supplemental codes that are used. And Category 3 codes are research or temporary codes. There are unlisted procedure codes in every category because maybe there's a new procedure, there isn't a code for it yet, so we have a special code. It's called the 99999 code, 66666, depending on what section you're in. That is an unlisted procedure. Now, in order to be paid for that, there has to be a lot of medical record documentation sent along with the bill to validate the use of that code. Coding terminology, bundled codes. Let's talk about bundled codes, all right? Bundled codes are usually used in the inpatient department, or sometimes if we're doing outpatient surgeries. And these include all the costs of the procedure. So say you're going to an ambulatory care center to have a procedure done, all the expenses and codes are in a bundled code. Concurrent care means you're being taken care of by 2 different doctors on the same day. All right? So maybe you go to the eye doctor and he's going to dilate your eyes, and then you're going to go to your regular routine doctor for a blood pressure check. So this is concurrent care. This is one example of concurrent care. All right? And a lot of times that type of care occurs when you're hospitalized and you're being seen by multiple specialists as well. Critical care is for those who are unstable and critically ill. Consultations, I'd like you to see the doctor about your repetitive urinary tract infections. I'm going to send you to a urologist. Counseling. Counseling is done if you go in for behavioral medicine or any other type of counseling. Maybe you're going in for nutrition counseling. and counseling is billed by amount of time spent. Downcoding, when you don't code, when you don't use the right code and you're underpaid. Unbundling, um, it has happened. Some places will unbundle those bundled codes and code for every single thing, and you're usually denied payment. Upcoding is fraud. Upcoding is when you're coding for things that didn't happen. This is called fraudulence, and you can, there's all kinds of federal penalties for that. The first part of the CPT book is the evaluation and management services, and these are called EM codes. Some of them are divided into new patient or established patient codes. And again, this part of the CPT manual answers the question, where did I go? All right, did you go to the doctor's office? Are you a new patient? Or are you an established patient? The office visits do look at new patient and established patient codes. There's different codes for each one, different sets. Did you go to the emergency room? Are you at an ambulatory care center? Are you at an urgent care center? Now, an emergency room is an outpatient procedure, believe it or not. It is just because it's in a hospital doesn't mean you're an inpatient. You're not an inpatient until you're admitted into the facility. Did you go for counseling? Did you go for an office visit for a consultation? Are you in rehab, long-term rehabilitation care for closed head injury? Are you in short-term rehabilitation care because of your knee surgery? So evaluation and management answers those questions. And the key factors in determining the service level in E&M is the patient history, the physical exam, and the medical decision-making. Here's an example. Patient comes in with an earache. Their ears hurt. The ears have hurt for 2 days. That's a patient history of the current condition. The physical exam, the doctor looked at the ear, nose, and throat. And medical decision-making was straightforward. Yes, you have an ear infection. All right. And these are determined by the physician. These are not determined by anybody else but the physician. Contributing factors in assigning codes are counseling. Was counseling done during the office visit? So there's another set of codes to use. Is this a coordination of care? Are there other people involved in your care? What is the nature of the presenting problem? Again, just like my ear hurts. And the time spent with the patient must be tracked. And that is part of these key factors in determining service level. The surgical coding. We have a surgical global period. So from the first day you see the surgeon in the office for the first visit until you see him at the 6-week checkup, that is the global period. And during that time, the surgeon cannot charge you for other things, other office visits. That if you have to see your doctor 4 times because of the surgery, then that is the global period. So it cannot be charged more. It is a set fee. We have different systems. Now, we have the integumentary system, the musculoskeletal system, the respiratory system. Again, these are by body system. Cardiovascular, hemic lymphatic systems, mediastinum and diaphragm. Digestive system, urinary system, male genital system, female genital system, maternity and delivery. The endocrine system, the nervous system, the eye and ocular adnexa. The adnexa are the structures around the eyeball. The auditory system, radiology, laboratory procedures and panels, and medicine and immunizations. Under the surgical codes for all the different body systems, up until you get to radiology, those systems are coded from head to toe, except for the female genital system that's coded from the exterior labia and the vagina to the fallopian tubes. But everything else is coded from the top of the head to the toes. Using the manual, you have to verify the procedure and documentation. The doc says he washed this person's ear out. Did they do it? In the SOAP note, it says, yes, we did an ear lavage. Now you have to select the procedure code from the alphabetic index. Just like in ICD-10 coding, you go to the alpha index first, and then you go to the tabular index. So the alpha index gives me a code 37542. And so now I'm going to go to the tabular list in the body system for the respiratory system and see if the 37542 is the right code for ear lavage. It isn't. I'm just giving you a code. Now you'd have to determine the need. Do we need modifiers? Did he do both ears? If he did one ear, we're fine. But if he did both ears, then maybe we need to do that 5-digit code with a dash sign 52, which means bilateral procedure. See, the more specific we get in explaining with the procedure codes, the more you're going to get reimbursed or paid for the procedure. And the primary reason for the visit is listed first on the account, on the bill, on the electronic bill that's going to the insurance company. Again, code linkage. This means that the medical record has to confirm the codes that are used. It has to validate the codes that are used. Now, you have your HCPCS coding manual, and this is the Healthcare Common Procedure Coding System. We call it HCPCS, the HCPCS manual. Level 1 of the HCPCS system are CPT codes, and you just learned about those. Level 2 are codes that CMS, the Center for Medicare and Medicaid Services, has created to cover supplies that are used by people with Medicare. So if we're using HCPCS level 2 codes, the patient is on Medicare. And it can be for supplies in the hospital, in the office, or at home. Either way. All right. There's a couple of CPT codes in there, but not too many. That HCPCS manual also includes pharmaceuticals that are used for the patient. Again, coding compliance, we talk about code linkage. And a lot of times Medicare will come in and say, we need to, you did 72 ABC procedures in 4 months. We want to see the medical record documentation that validates those codes. And they have a right to do that. And they verify the code linkage with a code audit. What about insurance fraud? Reporting services not performed or at a higher level than delivered. This would be upcoding. Or billing for procedures performed but not related to the patient's condition. That's fraud as well. Or unbundling or billing for the same service twice when it was only done once. Those are easy to understand. What about compliance plans? Do you have compliance plans in place? There will be a manual for compliance plans. And that ends our lecture today.